Hey there. Today I'm gonna tell you about this. You see it? How about now? You see it now? Yeah, that's it. I'm an adult with a baby tooth in the front. It's kind of weird. I had to come inside because it just got really loud outside. I wanted to share this story for a long time. I've thought for a good probably 6 months that I should make a video about this tooth because there's really not very much about it online. Having a baby tooth as an adult is kind of a weird, sort of a rare thing. It happens, but it's not totally common. But from what I've been told, it's typically in the back. So having a baby tooth in the front, the missing adult tooth in the front is the most rare way to have a baby tooth, I guess you could say, as an adult. I'm telling this story now because in a couple weeks I'm gonna get braces and start the process of kind of doing what I need to do with that tooth now, but I'll tell you about that in a minute. So in a couple weeks my mouth is gonna look different, so it's like now or never. This tooth is the first tooth that I ever got. I think I was around 8 months old when I got it, and so I've had it my whole life. In a couple days I'll be turning 34. It's yellowed, as you can see. I bleached my teeth, but no matter how much I bleach it, it just doesn't really change color. It's still pretty tight and secure, but it's kind of starting to get wiggly, and so that's why I need to start the process of fixing it. I think that part of why it's still so secure is because when I eat, the neighboring teeth take the brunt of the force, I guess, you know, when I chew, when I bite into things. I've been told by my dentist, actually a couple of different dentists, that if this baby tooth was in the back, because it would be a bigger tooth used more for like chewing rather than just like slicing through things, that it probably would be gone. But because it's in the front and it's more of like a knife, like a slicer than a crusher, that's probably why it's still here. So I'm not a dentist. I don't know any of the technical terms or anything, but just over time, you know, I've asked a lot of questions, and so what I've been told is that when there isn't an adult tooth underneath your baby tooth, that sometimes the root is especially long, and that when you have a baby tooth and your adult tooth is getting ready to come in, that it gives off, I don't know if it's an enzyme or a hormone or what, but something that kind of starts to erode or eat away at the root of the baby tooth, and that helps it get loose. So when there isn't an adult tooth there to give off that enzyme to eat away at the root of the baby tooth can last longer. The cause of this is genetics. It's hereditary. I have one relative who has the exact same tooth, exact same thing, and that's actually a sibling. Other than that, I don't know of anybody on either side of my family who has anything like this at all. Like I said, I'm about to turn 34. I did have braces around the tooth as a teenager, just to straighten my other teeth. It didn't have a bracket on it, and I've never had a problem with my baby tooth. It's just a part of who I am, and so as long as it's been healthy, I've never really even considered having it taken out or having it built up or anything like that. It is noticeable sometimes when I smile. It's mostly just noticeable when I talk, but for the most part, because it's an incisor, you know, it's on the bottom, it's just, I don't know, you gotta be looking to notice it, you know? So every time I go to the dentist, he always checks it just to see how tight it is. And I've noticed in the last couple of years that it seems like maybe it's getting loose, sort of. But I just had a dentist appointment a couple months ago, and my dentist said, yeah, it does seem like it's a little bit looser. And so that, like I said, is kind of like the trigger point where, you know, we were like, okay, well, so now we need to talk about options. One option is just to let it fall out and then have an implant put in. But the problem with that is that, according to my orthodontist, typical incisor, to put in an implant, that your dentist wants 6 to 7 millimeters, but he measured my baby tooth and it's only about 4.5 millimeters wide. So if I have an implant put in, it would be really thin and tall, and it's kind of dangerous because they wouldn't have a lot of room to put the implant into the bone. So that's one option, is just to let it fall out and then have the implant done. Another option is to obviously pull the tooth and then put in the implant. Another option, which is a lot more expensive and a lot more involved, is to have braces where we move my teeth around to make room so I can have a normal size implant and then make all my teeth look perfect. Like I said, I've had braces before and they bleach my teeth, which makes not perfect teeth look pretty good. But so that's the option that I'm gonna do. I'm getting braces, and after about 6 months of treatment of making room, my dentist will pull it, put in an implant, and once the implant is done, then I'll still have braces, and we'll use the braces to close that space and then align my teeth the way that they should be. As far as I know, having the little tooth hasn't affected my speech. It hasn't affected my ability to eat. I eat a lot of apples, things that are hard to eat, carrots, things like that. That's it, that's my quick little video. Again, I'll show you my baby tooth. There it is. There you go. Now you see it, and in a few months you won't. So let me know if you have any questions. If you have this, it would be interesting to see someone else with a baby tooth in the front. Like I said, I have a sibling who has the same thing, but other than the two of us, I've never seen another adult with a baby tooth in the front. And for the record, I was also born without tonsils. I know, I'm a freak.